I am Dr. Sumit Kumar Ghosh, Assistant Professor, Department of Medicine, SSKM and IPGMER Hospital, Kolkata. Today, I want to talk few words about the latest update in hypertension. As per WHO, nearly 63% of total death in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular disease, which affects 45% people in the 40 to 69 years of age group. Raised blood pressure is among the most important risk factor for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 50% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempt to address the issue that the resource of poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource setting. The American Heart Association and American Cardiological Society has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults, that is no ASCVD or 10-year CVD is less than 10%, with stage 1 hypertension, that is blood pressure in the range of 130 to 139 and 80 to 89 systolic and diastolic blood pressure. That in this group, management starts with a non-pharmacologic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacologic therapy. Acute respiratory distress syndrome is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeter mercury range substantially reduced cardiovascular adverse event in STEP randomized trial, affirming the sprint finding for an older Chinese population. Among sub 8,500 patients aged 60 to 80 in China, the intensive target trimmed 26% of the composite cardiovascular risk finding. From a second major trial supporting a lower target could unite the guidelines, which even among US professional societies range from threshold of 130 to 150 millimeter mercury. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommend that the diagnosis of hypertension should only be dependent on office BP measurement, but also should not be dependent on office BP measurement, but also on out-of-office measurements such as ABPM or home blood pressure monitoring. 24-hour and nighttime BP measurement were associated with greater risk of mortality and a composite CV outcome. Thus, they may be considered as the most relevant measurement for estimating CV, most associated with greater risk of mortality and a composite CV outcome. Thus, they must be considered as the most relevant measurement for estimating CV risk. For every 20 by 10 millimeter mercury increment of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs, considering high non-adherence treatment. Importance of combination therapy is particularly highlighted to improve adherence to the therapy and BP control. Therefore, in 2018, European guidelines recommend, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of SC inhibitor or ARB plus CCB or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of an unknown carcinogen, namely N-nitrosodimethylamine, NMDA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NMDA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in human. If 1 lakh patients would have received NMDA contaminated valsartan from Jianghuai manufacturing site where the highest level of contaminants was found every day for 6 years in the highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The presence of NMDA in this drug could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visit of +6%. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual awakening hypertension therapy exerts a favorable cardiovascular risk reduction. The largest study included a total of 19,084 hypertensive patients. During the average follow-up of 6.3 years, 1,752 participants experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differed during sleep. The RR reduction of cardiovascular events was significantly improved for nighttime when compared with the awakening treatment. Thank you, everybody.